this week and potentially next month in Congress could impact their patients. Before we begin, please note that the physicians speaking today are speaking as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we respectfully ask that you please only refer to them in any coverage as they introduce themselves, and please do not include any employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Rob Davidson.
Thanks, Annika. I'm Rob Davidson. I'm an emergency physician in West Michigan. I'm also executive director of the Committee to Protect Healthcare. I want to thank my fellow physicians from Ohio and North Carolina for making time today as well. I'm sure there's a million other things they could be doing, myself as well, like catching up on paperwork at the end of the year, squeezing patients in, trying to get their appointments, particularly those who may be losing health insurance in the new year, or even just working on our Christmas shopping. But once again, Republicans in Congress are forcing us to speak up on behalf of our patients and our communities. In just over 2 weeks, it will be New Year's Eve. When the ball drops in a matter of days, it won't just be the year on the calendar that will change. 22 million Americans will lose the enhanced premium tax credits that help them afford their healthcare plans on the ACA marketplace. Many of those Americans will see their monthly premiums double or more, and many won't be able to afford those sky-high premiums, so they've just decided to go without healthcare. Estimates are around 4 to 5 million people will choose to do that. This moment didn't sneak up on us. Democrats and healthcare advocates have been calling for months, pretty much all year, for Congress to take action to extend the ACA tax credits, but congressional Republicans have chosen to do nothing. In fact, just last week, Republicans in the Senate actively voted against extending the tax credits. I'm grateful here in Michigan that my two senators, Gary Peters and Alyssa Slotkin, voted in favor of extending those tax credits. But Republicans control the Senate, the House, and the White House, and Republicans have chosen to create a healthcare crisis for patients like mine and for millions of our fellow Americans. And just today, it was announced that House Republicans are doubling down. Speaker Mike Johnson says the House will not include the ACA tax credits in the healthcare bill he's trying to move this week. Make no mistake, this isn't just a crisis for people who get their healthcare through the ACA. When millions of Americans lose their healthcare because they can no longer afford their ACA plans, and when millions more lose their healthcare because of Republican cuts to Medicaid, hospitals operating on already thin margins will be forced to close. People will lose their healthcare, jobs, and in turn, their own health insurance. More people will be forced to seek care in my emergency department, and many of them will wait too long to come in because of the cost. I can remember before the ACA, a guy in his 50s having chest pain for 5 days, finally came in on day 5 because he was so short of breath he couldn't make it up the stairs. Turned out he had had a heart attack and had been having ongoing damage for that time. And when it came to me, it was in heart failure. His heart was functioning at about 15 to 20%. Had he come in at the first sign of pain or in that first day, he could have been taken to a cath lab. He could have had a stent. He could have salvaged his heart muscle. Instead, people like him end up on disability simply because the cost of coming in when you don't have insurance is just too high. With more patients in the ER and people losing insurance then have to come to the ER because they can't go to their primary care doctor for even basic things. And so when they come in, unnecessarily, even people who have insurance will be forced to wait for longer care. Republicans aren't just letting a healthcare crisis develop, they're actively creating it. And the ripple effects will be felt for years, likely even for decades. But there's still time to prevent much of the damage. Republicans in Congress can work with Democrats to extend the tax credits now, and then work on other ways to reduce healthcare costs in the future. And I promise you, we will be there with them to help them do that. But we need action now. Republicans must extend the ACA tax credits now. Now I'd like to introduce my colleague in Ohio, Dr. Romanos.
Thank you, Dr. Davidson. I'm pleased to be here today to get to talk to you about this. If I can get my video right. I'm a family doctor. I'm located in Columbus, Ohio. And as a family doctor, we get to know our patients over many, many years. I know about their families and their hopes for the future and their concerns. I hear what they're struggling with. And lately, I hear that many people are struggling. For years, patients have been asking me how they can cut corners with their healthcare. Maybe they don't get all the lab tests that I want, or they don't take all of the medicine that I prescribe. Maybe they want to split pills in half. Any way to make their money go a little bit further to get the best healthcare that they can afford. And some just can't afford the healthcare that I recommend. When I see a diabetic patient, it's pretty easy to know whether they're doing well or not. There's one number we look at called an A1C. And you can see in our electronic record when people are doing well and they're just going along. And then you can see when that number jumps up. And I recently had a patient whose number jumped up. And I said, "What happened?" He said, "I lost my job. I didn't have health insurance and I didn't have my insulin. And then when I got on the ACA, it went back down," right? So we can see firsthand when people have access to healthcare and medicines, their health improves. They know how to take care of themselves. And I'm afraid that patients like that will struggle even more to pay their premiums in the next year. Now I'm hearing from patients that they're just going to go without healthcare. And I know exactly what will happen. When that is the case, those numbers will go up and they will end up seeing Dr. Davidson in the emergency room. Without the ACA tax credits, they just can't make healthcare work in their budget. So they'll be putting off screening, they'll skip it altogether, they won't carry health insurance, they won't just split pills, they won't take pills at all. I don't blame them. Everything is expensive: rent, childcare, groceries. Something has to give. I blame the leaders in Washington. They had an opportunity last week to help out working families and patients like the ones I see every day. They had an opportunity to ensure their constituents could continue seeing the doctor, taking care of themselves, and so they can take care of their own families, but they chose not to. Here in Ohio, our senators John Husted and Bernie Moreno voted against helping Ohioans afford health insurance. They voted to let premiums skyrocket. Earlier this year, Senators Husted and Moreno voted to give tax breaks to billionaires, but I guess healthcare for working families is just too expensive. What a slap in the face for my patients. Ohioans deserve leaders who look out for them, not billionaires like Donald Trump himself, who mocks affordability. Ohioans deserve better than Senators Husted and Moreno. For more, I'd like to introduce my colleague in North Carolina, Dr. Abdul Baqi.
Thank you. Thank you for having me. Would love to not be here because this had been solved and the people that we elected had done the right thing, but here we are. I am an OBGYN. I have chosen to practice in rural America. I practice in Southwestern Virginia and in North Carolina, Rockingham County, North Carolina, and have just moved there. So now Senators Tillis and Budd are representing me, but not representing what I desire and what my patients are needing. Um, Without the subsidies, I know of one person whose premiums are going to double. It's for her and her daughter, and she currently pays with the subsidies approximately 400 a month. And now without the subsidies, because these bills are due, I myself just paid my insurance premium. The bills are due by December 15th. You needed to pay so that you could start insurance January 1st. So her bill went from 400 to 800. It is still a choice that she's able to make, but really, is healthcare a choice? It's not. It's not. Because when you need it, you absolutely need it. And when you don't have it, people suffer and people die ultimately. And so she is able to afford the $800 a month. But honestly, we know that that means that something else is going to give. Something else is not going to be paid for or bought on at the same time. And it's just a shame when, as Dr. Davidson said, this is a completely Republican created tragedy. In my own area of North Carolina, if things stay the way they are, we are looking at the closure of 5 rural hospitals. I can tell you one of the hospitals is one that I operate at, UNC Rockingham. And what that will mean is that people will have to go further and further away for their care. And let me reemphasize, I'm OBGYN, so going further and further away from for care means that Moms are not getting the care that they need in a timely fashion, and it means that moms, babies, and families suffer when a mom can't get the care that she needs. We can miss birth defects, we can miss interventions, and that's the obstetrics part, but the gynecology part, talking about pap smears and mammograms, we are able, the reason why we have October as Breast Awareness Month and we see millions of women proudly wearing their pink and walking is because of prevention and also early detection, because we know early detection saves lives. Without a mammogram, we're not going to be able to pick up breast cancer when it's early. We will be picking it up when it's stage 3, stage 4, and that means someone is losing their mother, someone is losing their aunt or their sister or their daughter. But it just appears as though the Republicans that we've elected don't care about those things as long as it's not their family. And I think we just really need to push them on the fact that our families matter, our healthcare matters, and we need to get the ACA subsidies extended while we work on the other fixes that need to happen. But the ACA subsidies extension is of the utmost importance because the time is now. It really, as I said, I signed up over the weekend because December 15th was the deadline for it to start January 1st. And I will hand it back over to Dr. Davidson.
Thank you, Dr. Abdulbaki. Since this is such a moving target and everything is really happening this today, last few days, getting new reporting on this, I wanted to kind of do a little overview of kind of what that means. It looks like there's a bipartisan group of senators talking about something they think they might be able to try to get done. But again, no assurances from their leadership. And then they have to agree with the House. So they can't even get agreement within their own chamber. In the House, it was announced today that Speaker Johnson said there will not be a vote on subsidies. And so even if the Senate comes up with something that includes a subsidy extension, the House is saying we're not going to do that. And so, the House has introduced, or they're planning to introduce a bill, I believe, tomorrow that kind of deals with some things around the edges, allowing for more association plans. These are plans where smaller groups and businesses can get together and buy insurance. They don't have the protections of the ACA. They can exclude people. They can price people out. They tend to pool people in very low risk pools, leaving higher cost, higher risk folks to buy on the ACA, thus driving up premiums for everybody and having more people fall out of insurance, then kind of repeating that cycle. They have some thoughts that we think are important, right? Pharmacy benefit manager reform, absolutely, right? We've advocated for banning facility fees. We've advocated for site neutral payment reform. Absolutely essential pieces to make healthcare more affordable. The problem is this is an absolute emergency, and I can use an analogy, and I think it really does work. If someone comes to the ER having crushing chest pain and they're having a heart attack in front of me, I'm going to give them drugs to reverse the effects of that heart attack. I may give them drugs to break up a blood clot to get blood flow back to their heart, or we'll fly them in a helicopter to get a stent put in their heart. I'm not going to sit down and have a conversation about diet and exercise and review, their medication list to see, can we increase your cholesterol medicine a little bit? Like that'll happen in the next few days once we actually save their life. We have people clinging to a lifeline here, having insurance that today, I believe, yesterday or today, the last day they could sign up for 2026. And they're talking about plans where they're going to recess for the holiday break and come back next year and try to work it, or the House is talking about plans their own caucus can't even agree on, let alone getting it through the Senate. I mean, it's absolute insanity. And you hear it being talked about on the Republican side as a political liability, which it certainly is. But to me, that makes it even worse that is the calculation from which they are coming to talk about these reforms. We're here just to let you know, as physicians and as health advocates, this comes down to patients. It comes down to 5 million people losing insurance. It comes down to the people that we've told you about today and the kinds of people that they represent, the millions of people around this country that will go without, that will not come in when they're having chest pain, whose whose blood sugars will be out of control because they don't have insurance. These are the folks we're talking about. These are the folks we're fighting for. And these are the folks who need a lifeline. And really right now, the only viable solution is an extension of the subsidies so people can buy insurance, give them a lifeline, then we can all get together and fix the system that definitely needs fixing. Thanks. And I'll hand it back to Annika.
Thank you, Dr. Davidson, and thank you, Dr. Romanos and Dr. Abdul-Baki. We'll now open it up for questions. I see a question already from Lynn. If you have additional questions, you are welcome to use the Q&A like Lynn did, or you can put it in the chat. Or if you prefer, you can raise your hand and I can allow you to unmute to ask your question verbally. But we'll start with the question from Lynn. I believe this is for Dr. Abdul-Baki. North Carolina has a high infant mortality rate, and the racial disparity in infant mortality is widening. Do you anticipate people not being able to afford insurance will exacerbate racial disparities in maternal health and infant mortality?
Definitely, definitely. That's the reason why we're here and why we're fighting, because we understand that access to care is the very basic first step in dealing with any of these health equity issues. You can't have equity if you have no access. It just isn't possible. So yes, for the woman who is uninsured or has lost her Medicaid or works. Again, I want to dispel the myth about who's getting Medicaid. I have been in practice for more than 20 years. Most of my patients on Medicaid work. They work at jobs like Walmart and calling centers. These are the people who are getting welfare, the corporations. That's what we've decided to do in this country is give corporate welfare and to give any individual person the help and the health care that they need seems to be, a big issue. But yes, you have hit the nail on the head that losing health insurance means that we're going to see an increase in the racial disparities among maternal mortality and infant mortality. And basically, on any of the other things that you can think of cancer diagnosis, heart attack, stroke, any criteria you can think of, we will continue to see widening disparities as people lose their insurance. Thank you for the question.
Um, there is a question in the chat from Michael. Can you give your perspectives on health savings accounts? Another idea posited by Republicans. Is the amount being discussed even close to covering care for chronic or serious illnesses? I think that's for any or all of you. I'll repeat it. Can you give your perspectives on health savings accounts? Another idea posited by Republicans. Is the amount being discussed even close to covering care for chronic or serious illnesses?
I can just take a little crack here. So to answer the second part first, of course it's not enough, right? Senator Cassidy and Crapo, that was a plan that they introduced. I think that did not pass the Senate. And basically what that did was give $1,000 or $1,500 for people over 50 into a health savings account, right? A tax advantage account that allows people to pay for healthcare items, buy some acetaminophen at the store or go and pay for part of an x-ray. And I say part of a test or a procedure because $1,000 in the current healthcare economy doesn't buy you much. It's not going to buy you an MRI in most places, right? It's certainly not going to buy you an appendectomy or a heart cath. And so they're tying those to bronze plans or catastrophic plans, which have extraordinarily high deductibles, $8,000, $10,000, up to $12,000 deductible. So when you tell someone we're going to give you this little bit of money, but you're going to have insurance that requires you to pay 10 times that to actually have your insurance kick in. For most people, it's like not having insurance. I think the most recent data I saw, 37% of people can't afford a $400 emergency. So if their muffler falls off, they can't afford it. How on earth are they going to afford a cancer diagnosis or a heart attack or a stroke? I think HSAs are great for people who are high wealth, who are in high income tax brackets, who have excess money just lying around and they can stick away and save on taxes. they haven't worked out so well. I think KFF has had lots of different analyses, and I don't have the exact reference, but I've seen them all, and disproportionately, health savings accounts favor people with high incomes and higher tax brackets, and folks who are already sort of just living paycheck to paycheck aren't able to just sock it away. They're in lower tax brackets. It's not as much an advantage, so it's just not a real solution. Again, would it be great if the government wants to fund HSAs for everybody in addition to extending subsidies and in addition to lowering costs? Sure. I can't imagine people who wouldn't sign up for that. Sounds great. As a solution to the crisis at hand, not even close.
Thanks for the question. We'll allow another minute or two in case there are any follow-up questions. In the meantime, too, I will say that we have been recording this. And so if you'd like a copy of the recording, send me a chat or send me an email where you RSVP'd, and I can send you a copy of the recording after. Michael raised your hand. I'm going to allow you to talk, Michael.
Thank you. Sorry to make it go longer, but I wonder if the answer is similar to the previous question that was already asked, that makes sense to me too. But I know North Carolina has got such a large rural population. I wonder if you can talk a little bit more about how in these rural communities these problems are going to be even worse, and with an even bigger divide between getting any kind of solution available at all.
Yeah, I can tell you just a day in the life of my patients, or even when I try to hire someone for my clinic. I tell them straight up that we are dealing with people that are great people. I love them as patients. I love seeing them at soccer games, but they overall are under-resourced, or we're living in a community that has low resources. So it is nothing for me to have a decent no-show rate because simply someone doesn't have enough gas in their car to get to clinic. We don't have Ubers. We don't live in an area where there are Ubers and Lyfts because we in the rural America, that's not how you get around. It just doesn't even exist. So transportation is a big issue. Cars break down. As Dr. Davidson said, the recent polls show that more than a third of Americans can't afford a $400 emergency. So that means that if the brakes go out on your car, you're done. Like, you don't have transportation. And in rural America, with no Uber, no Lyft, no public transportation, you are stuck. You are stuck depending on family and friends who are often in the same economic circumstances as yourself. And so, yes, any disparities makes it hard to get from place to place. Like, we have absolute medical meccas. We are the home of Duke University and UNC Health System and the Carolinas and Atrium. We have awesome healthcare in North Carolina, but access is an amazing issue. And the rural areas all across America, nothing really unique about North Carolina, but all across America suffer when we don't deal with infrastructure, and how do we get someone from point A to point B? Because transportation is a big issue. Just having the money for gas, and just having the money for medications. All of those things become bigger problems when you take it from an urban area to a rural area. And so, yes, it's worse.
Thanks for that question. Dr. Davidson, there's a question in the chat for you from John. Can you expand a bit more on how this will lead to hospital closures? And then after that, there's a question for everyone if you want to start thinking about it. Would the idea floated by some Democrats to let the HSA payments be used directly for premium payments be an effective workaround, or would that be insufficient for keeping people on their plans? So we'll let you start, Dr. Davidson, with a question
Yeah.
about how this will lead to hospital closures.
Yeah, I mean, similar to the cuts to Medicaid, when fewer people have insurance, right? They still come in. We see them. We have a federal law, thank God we do, EMTALA, that was under attack regarding abortion rights. And I think we put that on hold for a bit with the Supreme Court. But having EMTALA and just having a conscience, we treat these folks that come in, whether they have insurance or not. They then get bills. A lot of people can't pay the bills. They get GoFundMes. They go into medical debt. And a lot of those bills just don't get paid. So the hospitals have to eat that. Now they try to pass it on, right? So everybody's costs will go up, but it eventually with hospital budgets that are already kind of hanging on a knife's edge, these places will close. We've seen some announced already. We've seen a lot that are, threatened to be closed. And the Medicaid cuts did a lot of that, and cutting more people from insurance is just going to exacerbate that, right? Pour fuel on the fire. I think that, and I'll speak from a rural perspective as well. I've worked in a rural emergency department for 23 and a half years. And those hospitals are like the center hub of all activity and economic activity in small towns. It's where the majority of people are employed in small towns. And so if you start losing services at the hospital, losing jobs in the hospital, people go away. They got to find jobs somewhere else. You can't just turn it back on, right? This isn't a matter of, well, in a year or 3 years, we change things, policies change, we can get all this back. Sometimes they don't come back, right? We see that with manufacturing that we've lost in this country in certain areas, in the Rust Belt in particular. It doesn't just turn back on. You can't turn on the spigot. So I think that piece to me is particularly concerning. Just again, for all of us here, because we have a conscience and we care about this stuff, but just particularly where I work, and I have done so for so long. I can just take a quick crack at the HSA part. I mean, again, sure, having extra money that is provided, just like the subsidies are, great. I mean, let's all sign up for it. The problem is, particularly the numbers Cassidy Crape are talking about, $1,000 or $1,500. We're seeing people's premium increases going up by that much a month. So I mean, I guess if it'll help pay for maybe 1/12 of those increases, and then the other $10,000, I guess it doesn't really add up. The math doesn't math, so to speak. That's my thoughts. I don't know if other folks have other thoughts.
Yeah, just to co-sign what you said, the average premium increase is supposed to be $1,000. So that would pay for 1 month. So um, it's insufficient, definitely insufficient, and doesn't solve anything. Most of the solutions that the Republicans propose are really and truly meant to help wealthy Americans stash away more of their money. These are tax advantage plans that help you put aside money that it's pre-tax dollars, and so you can put aside the money and save 10,000, 20,000, 30,000. That doesn't get taxed, and you can use it for a health, you know, your health premiums, et cetera. But guess what? Most of my patients don't have $20,000 just hanging around, so it's not going to help them.
Thank you, and thanks for those questions. We'll allow just another minute. Again, if you'd like a copy of the recording, please let me know and I can send it to you a little bit later this afternoon. I am not seeing any other questions, so we will go ahead and conclude for today. Thank you, everyone from the media for joining. I know it's a busy time, so we appreciate having you here to hear about this really critical issue for patients in Michigan, Ohio, North Carolina, and across the country. And thank you so much to our speakers, Dr. Davidson, Dr. Romanos, and Dr. Abdul Baki. We really appreciate your time and your advocacy on behalf of your patients. Thanks so much and have a great afternoon.
Thank you. Bye.